Today we will be discussing the evolution of medical device reprocessing. Since the Middle Ages, we have come a long way in how we handle medical instruments and how they are reprocessed. One of the oldest forms of surgery is trepanning, also known as trepanation. During 5000 BCE, if an individual began to act erratic or show signs of questionable behavior, trepanning was a suggested method of treatment in an effort to ward out what was once believed to be evil spirits. These operations were usually performed using a sharp knife or trepan tool without the assistance of anesthesia. As of 2019, trepanation surgery is still used in medical field today, although protocols and practice have changed significantly since the Middle Ages. This operation was also performed if individuals had suffered from acute migraines in an effort to alleviate their symptoms. This surgical intervention was performed by drilling or scraping a hole into a person's cranial bones, exposing the dura mater. Before the Industrial Revolution, a variety of instruments were used to perform various medical procedures that have since been removed. Along with the multi-bladed fleam, some of these instruments included the amputation saw, lithotome, and the tonsil guillotine. In healthcare, the amputation saw was used for amputating limbs that no longer served a benefit to the patient. These instruments were often considered to be a prized possession to the surgeons as it displayed their affluence due to the instrument's high expense and elaborate design. The amputation saws ended up being a major problem to patients as germs were often left to harbor between the grooves of the saw blades. During the 18th and 19th century, lithotome instruments were used during bladder surgery in an effort to remove kidney stones. Lithotomes contained a hidden blade that was released via a spring during the operation. These instruments were later washed by hand once the surgery was complete by only using warm water. In the 1860s, tonsil guillotines were used during tonsillectomy surgeries. These instruments were able to slice both infected tonsils during an operation at the same time. Tonsil guillotines often ran into problems as it often caused patients to hemorrhage. During this time, tonsil guillotines were not the most precise medical instrument as their design often left remnants of infected tonsils in the patient's mouth. Because of this, tonsil guillotines were replaced by forceps and scalpels at the dawn of the 20th century. After the Industrial Revolution and further education on the subjects of viruses, bacteria, and prions, we as a society have developed stronger tools to eliminate these harmful contagions, thus ensuring optimum quality of health for people of the present day. With the invention of ultrasonic cleaners, washer disinfectors, and steam sterilizers, a variety of instrument tracking systems, we as a society have developed a stronger healthcare system that is more safe and effective for all.
Nowadays, by technology developer, the automatic cleaning equipment has been made the cleaning processing way faster and easier for sure. For example, like the device wash and the car wash. Devices are now ready to go through the washer disinfector. The conveyor will automatically take the load to an available washer. In the background, you can see a car that is bringing devices from the cleaning side. These devices have not passed inspection and must be processed again. This load will take 46 minutes to clean. Larger devices and containers will go through the car washer. Car will come out on the other cleaning side. "46 minutes after completion in the washer, disinfector devices will come out on the cleaning side and go through the assembly and packaging area. The trolley will automatically go to the washer that has completed its cycle. The tray will be pushed to the end, where it will be picked up by staff. Items are offloaded to the layer assigned table in the assembly area.
The autoclave sterilizers are used to sterilize surgical equipment, laboratory instruments, and pharmaceutical items. It can sterilize solids, liquids, hollows, and instruments of many shapes and sizes. Autoclaves come in different sizes and functionality. A very basic autoclave is similar to a pressure cooker. Like pressure cookers, Basic autoclaves use the power of steam to kill bacteria, spores, and germs resistant to boiling water and powerful detergent. Autoclaves have a chamber that heat instruments above boiling point. Most clinics have a smaller tabletop autoclaves similar to the size of a microwave. However, hospitals use large autoclaves that are also called horizontal autoclaves, normally located in the medical device reprocessing department and can process a number of surgical instruments in a single sterilization cycle. This allows staff to keep up with ongoing demand for sterile equipment in operating rooms and emergency wards. An autoclave sterilization agent is steam. Less than 3% humidity produces what's called dry or superheated steam, as this steam increases sterilization time. Superheated steam lowers humidity to about 0%. This transforms the autoclave into a dry heat oven. What takes 3 minutes in an autoclave at 135 degrees Celsius takes 2 hours at 160 degrees Celsius and 30 minutes at 180 degrees Celsius. However, humidity that's greater than 3% generates saturated wet steam, which requires higher sterilization pressure and temperature. Also, wet steam extends the drying time at the end of the sterilization process. Dry loads are required at the end of the process before equipment is wrapped. As the ultrasonic waves spread through the detergent solution, they produce alternating tensiles and compressive force that oscillates at the same frequency as transducers that produce them. These oscillating forces cause millions of microscopically sized cavities to form. Once the critical threshold is reached, these cavities violently implode, causing submicroscopic voids to form by a process known as cavitation. These powerful suction effects are due to high-energy hydraulic shock waves. These shock waves can reach temperatures as high as 10,000 Fahrenheit and hydromatic pressures as low as 10,000 pounds per square inch.
As mentioned before, surgeries have been performed for thousands of years. Since then, we have made many advances in the medical field, including how instruments are labeled. This next section will focus on the evolution of instrument tracking. In the past, instruments were not labeled. The surgery would be performed, the instruments would be gathered and cleaned to later be reused in another surgery. This process was not very convenient, as instruments would get placed in the wrong surgical trays, or worse, get left behind in the patients, an event known as a never event. Each method has its pros and cons when it comes to either convenience, cost, and patient safety. But as medical device reprocessors, we know that patient safety trumps all. It was named a never event as this event should never happen to a patient. Since then, we have tried many different ways to label instruments in an effort to properly identify and keep track of surgical instruments before, during, and after surgeries. We have tried etching, taping, dipping, and now we are moving towards a new idea, RFID tracking. Surgical instrument etching was one of the first practices used. This practice involves carving the instrument's information into the instrument directly. This may have been easy and convenient to do and relatively inexpensive, but the risk it posed to patient safety was tremendous. According to the Association of Advancement of Medical Instrumentation, this process can damage the hard, protective chromium oxide layer known as the passivation layer and create an area where bacteria can grow and where rust and corrosion could occur as well. Carving the instruments can also weaken the box law and create fissures where microorganisms can hide and easily be missed during the cleaning process. This practice is no longer in use due to the risk of infection it poses to patients. Practices still used today include instrument taping and instrument dipping. Instrument tape and dipping materials, when used properly, can help workers to identify specific instruments quickly and improve turnover times. These techniques, unlike etching, leave the instrument surface intact and add the benefit of color coding. The label must be able to withstand the surgical procedure as well as the many steps involved in the cleaning and sterilization process. When choosing your tape, ensure you are using tape valid for the sterilization process the instrument will be subjected to. One thing to remember is that these marking products do wear out over time. Therefore, there needs to be continuous maintenance to ensure intactness of the labels. Worn out or chipped labels increase the surface area for bioburden and bacteria to grow and increase the chances of the label falling into the patient during surgery and being left behind. Current practices do not mandate verifying intact instrument labels as part of the instrument count during surgeries. This is why constant inspection of the label is extremely important for patient safety. Once a label has become chipped or damaged, it needs to be replaced immediately. For instruments that have tape labels, the replacement process involves removing the entire label using an adhesive remover provided by the manufacturer to ensure no residue of the old label is left behind. Then the instrument can be washed and relabeled properly. For instruments that have undergone nylon dipping, the instrument needs to be sent to the manufacturer to be redipped, as we cannot redip them in hospital. Now, on to Carolyn, who will talk to us about laser data matrix etching.
A relatively new and advanced instrument tracking system is the data matrix, a unique code that is laser etched into each instrument. Due to new regulations requiring healthcare facilities to implement better tracking and unique device identification, the data matrix system has become one of the most widely preferred in the industry due to cost saving and increased efficiency. A data matrix code is a permanent 2D barcode that is used for instrument and product labeling or tracking in today's hospitals around the world. The data matrix code is laser etched into the surface of the instrument. When scanned into the accompanying computer software, the unique code provides information on the instrument's serial number, healthcare institution name, and other relevant tracking data. As the code is laser etched into the surface of the instrument, it does not compromise the passivation layer and leaves the instrument smooth and intact. This extends the lifespan of the instrument considerably compared to the previously used scratching method. Instruments can be reprocessed easily over many years as the resulting market surface still has its anti-corrosion laser. There are currently few viable options on the market that can hold up to the laser data matrix system. Methods like inkjet, hot foil, and screen printing cannot hold up to the harsh chemicals and temperatures used for device reprocessing. New advances in this technology have led us to be able to more easily mark previously difficult materials, such as silicone and polyamides. This system is being implemented in top healthcare facilities to ensure proper decontamination, tracking, and storage of the laser-etched instruments. In hospitals where the data matrix is already in use, it can help prevent instrument migration, save hospital staff's time that would otherwise be wasted hunting for missing instruments, and save the facility money in the long term. Time, money, and manpower does need to be allotted to implementing this system, but it can significantly increase the efficiency and quality of decontamination and sterilization of instruments, which in turn positively benefits patient care. Now, on to Ashley, who will introduce you to our newest technology on the market, RFID tracking.
Haldor Advanced Technologies has created an elaborate instrument tracking system called OR Locate that uses radio frequency identification technology to track and identify surgical instruments inside and outside of the operating room. In the OR Locate allows for a quick count of instruments and compatible disposable surgical materials. The OR Locate system uses RFID trackers for surgical instruments as well as sponges in order to increase patient safety. Being the number one priority for healthcare providers, increases in patient safety are an asset, and RFID technologies allow for the healthcare team to easily identify whether or not an item has been left inside the surgical site. The tracker counts the instruments and sponges before and after the procedure and will alert the surgical team in the event of a discrepancy or accidental instrument disposal. This not only saves expensive instruments from accidentally being thrown away, but it also saves the patient from having further surgeries to remove a retained surgical item. Once the surgery is complete and all the items are accounted for, the system will dispatch the medical device reprocessing department and let them know that a set is on its way down. This allows the reprocessing department to prepare and know which sets are coming down before seeing them so they can plan accordingly. This system also allows medical device reprocessing technicians to access information specific to an item's reprocessing instructions indicated by the manufacturer. This should eliminate improper reprocessing procedures and help to avoid damaging the instrument, and this can be particularly helpful in the case of a loaner instrument set, since these can often be unfamiliar to hospital staff. The RFID tracking system also allows the healthcare facility to quickly access the specific instrument's history, including past surgeries and sterility. If the facility uses the compatible 3M incubator, the system links all BI results to the instruments, and this should make it much easier to recall any sets that may have been part of a failed load. It will also keep track of whether the item has been sent out for maintenance, so tracking defective pieces is also made easier. The RFID tracking system saves time and reduces confusion in the OR and the MDRD, and virtually eliminates human error. The The RFID tags do not affect the finish of the instruments, which means that there will not be any crevices or fissures in which bioburden or bacteria can hide, which can make sterilization difficult to achieve. This increases productivity and patient safety by working towards the elimination of these risk factors.